Welcome back. Today we'll learn about bioavailability. Let us first understand what is meant by bioavailability. Bioavailability is the rate and extent to which the active drug reaches the bloodstream. In simpler terms, it's the amount of drug that reaches the bloodstream to exert its action. To make this topic more clear, let's understand it through the water flow analogy. Imagine you have 5 liters of water to water your plants. When you start watering it through pipe, you notice the pipe had some leakages that lead to some water loss. And ultimately your plants got only 3 liters of water instead of 5 liters. So the amount of water you plants got after water loss through leakage is bioavailability in our case. Imagine pouring water is drug in our case. Garden here is body in our case. Pipe equals liver and GI tract. Leaks in the pipe equals first pass metabolism losses. The amount of water that actually reaches the plants equals bioavailability. Bioavailability is important for calculating doses for orally administered drugs. When a drug is given orally, not all of it reaches the bloodstream because incomplete absorption from the gut, or first pass metabolism in the liver. And as a result of this, bioavailability of orally administered drugs is less than 100%. Drugs that are administered through IV route have 100% bioavailability, as they directly reaches the bloodstream. Now you may wonder, how do we calculate bioavailability? If 100 milligrams of a drug is administered orally and 70 milligrams of this medication is absorbed unchanged. So how much is bioavailability of this medication? The formula for calculating bioavailability is the amount of drug that reaches the bloodstream divided by the amount of drug administration into 100. It is indicated by F. So substituting the values in the given formula, the amount that reaches the bloodstream is 70 milligrams, and amount of drug administered initially is 100 milligrams. We get hundreds cancels out each other, and the bioavailability of this medication is 70%. Using that formula, it is difficult to calculate bioavailability. So practically, it can be determined by comparing the plasma levels of a drug via oral route to the IV route. The plasma concentration of a drug versus time are plotted and area under curve measured, AUC. The total AUC represents the total drug exposure over time. To find the bioavailability of an oral drug, we compare the total drug exposure in blood after oral and IV administration. The total exposure is measured by the area under the curve, AUC, in the plasma concentration time graph. If both doses are the same, the ratio of the AUCs directly gives bioavailability. We use this formula. If the doses are different, we correct for it by multiplying with the dose ratio. That gives us this formula. With this, we've completed this topic. That's all for now. Keep mastering, keep learning, only on Mastering Meds.